Knock, knock, knock. Hi there, my name is Margaret. I'm gonna be your nurse today. Can you confirm your name and date of birth for me? Awesome. I'm gonna check your wristband and your orders. So I'm here to do a central line dressing change on you and to draw some blood. Do you have any questions before we begin? No, okay. I'm gonna place the bed in a semi-Fowler's position and place a mask on the patient and myself. I'm then gonna perform hand hygiene and put on some gloves. I tell the patient that if they need to cough, I ask that they turn their head the other direction away from the site. I'm looking at this site now. I'm making sure everything's closed before I get started and there's no glaring problems. I'm going to begin to remove the dressing while stabilizing the catheter. Okay. I don't see any redness, irritation, swelling, or discharge, so that's great. Make sure those are lying nice. Going to remove my gloves and perform hand hygiene and then get my sterile field ready. So I'm going to open this up, maintaining the sterile field, and then I'm going to open my gloves. Okay. Oops. I'm going to grab the inside of this glove and then outside here. So just that. Okay, and then I'm going to grab my sterile gauze and my cleaning solution. And I'm going to clean around the site using back and forth motions, starting closest to the site. I'm beginning to work my way out. I'm going to clean anything that would be under the Tegaderm, so just being very generous with it. I'm going to clean for at least 30 seconds. I'm going to clean the tubes as well. All right, now I'm gonna let that dry for 30 seconds without fanning on it. Then I'm gonna place BioPatch blue side up and get my Tegaderm ready. Apply it, making sure that I can see the site well. And I don't need to be sterile anymore. Okay, all looks good. I'm gonna label initials, time and date, and place that on. And I can also apply this tape if necessary. And clean up my space a little bit, and then get ready for the blood draw. Okay, so I'm going to open a new saline. And this would be sterile, but I'm just gonna clean this for 15 seconds, letting it dry. Then I'm going to prime this. Oops. It's last used for blood apparently. And keep it sterile in the container. All right, next, I'll open my next saline. I'm going to pick a site. I'm going to open it. Let it clean. Move my cap. I'm gonna prime it. Okay. And then pulsatile flush. 10 mLs. Okay, I'm gonna check for blood return, which I get, and I'm gonna draw 5 mLs of waste blood. Okay, there we go. And then I'm going to put that there for just a sec. Get my sterile one ready. Going to remove this, make sure it gets in the sharps because it does have blood. I'm gonna clean again. Make sure it stays sterile. I clean for 15 seconds and then let it dry. And now I'm gonna pull up 3 mLs of blood. Okay. And then I'm going to clamp this and just let it hang out for a sec. I'm maintaining the sterileness of this. Just going to attach this here. And get it in here. Once it's taken what it wants, this is going to go in the sharps as well as this. And then I'm going to label this, patient name, date of birth, date, time, and send it to the lab. And then I'm going to change this. So I've already closed it and I'm gonna double check that. And then I'm going to remove this and clean. 15 seconds, let it dry. This is already primed, but I just like to double check and I'll remove the cap and then screw it right on. And I'm going to open this and flush. Okay, then I'm going to get my cap ready. And replace the cap. All right, I'm gonna now make sure all this stuff gets in the sharps, this gets to the lab, I'll clean everything else up, make sure my patient's comfortable, they have their call light, their bed rails up, the bed down, and everything like that, make sure they don't need anything, and that's that.